Hello, my name is Ryan Albino, and I'm here to talk to you today about kleptomania. Kleptomania has been categorized as an impulse control disorder, and what kleptomania really kind of is it's been called the stealing disorder, with reasonable reason. Uh, it's categorized by DSM-5 as the inability to resist the urge to steal items that don't benefit you, and for the most part, that's kind of what happens with kleptomaniacs is that they really don't. They steal little items like things from grocery markets and malls, and it doesn't actually benefit them. Like they can buy it with their own money. And kleptomaniacs also in DSM-5 kind of follow this little trifecta I like to call the triangle of stealing, where there's tension leading up to their theft, relaxation and gratification during the theft, and then they sort of go into a guilt phase after the theft. And the last part the DSM-5 kind of talks about is that the recurrence of this cycle, which is more or less true. Um, Now, there's a little issue with kleptomania being that it is a rare disorder. To give a good idea of prevalence, there's about fewer than 200,000 cases a year, which, if you note much, isn't really a lot of cases. Um, Now, onset for this disorder is roughly about 14, but it's been seen that it can kick in anywhere from 14 to the rest of your life. So there's not, and I think part of that really is that because people usually feel ashamed when they have this disorder, they don't seek treatment. So this disorder may have started at 15, but they didn't seek help till age 20 or 30 even. That's just it's very much so it's a problem with people more so than anything else. Now, the course of this disorder is also chronic, which makes it a very uphill battle disorder to fight, and means that people struggle with this for many, many years. This disorder also has a very high comorbidity rate. So usually, if you have this disorder, you also have another mental disorder. Usually, uh, the male to female ratios are a little strange on this one because so few people come out. So it's a little difficult to say, although two-thirds of the known kleptomaniacs at this moment are female, so that is definitely a factor. But in my opinion, I feel like that kind of comes in terms of that other studies have been shown that men are less likely to go seek help for health problems and mental disorders. So I feel like the number could actually be much higher for male or female, and it's just a factor of matter that this is a disorder that people view as very shameful, so that they don't actually seek help. But another factor about this in male to female is that they find that a lot of kleptomaniacs are married women. It's kind of strange, but depends. I could see some cases where it could technically work like that. The prevailing theories right now for kleptomania are like some of the general causes are low serotonin levels. God, serotonin seems like it comes back to every disorder, doesn't it? But one of the things is that low serotonin levels seem to have a direct impact on poor impulse control, and that is definitely has its ground. I would say it certainly could be a cause of it. Another one is the idea that instead it treats kleptomania instead of an impulse control disorder and as an addiction disorder, and that when people steal, they get a rush of dopamine every time that they steal, so that they will continue stealing, which is another possibility, yes, and it can very well be. Some big risk factors include family history, obviously. You can be biologically predisposed, especially if another family member of yours has a has a mental disorder, whether or has a substance abuse problem. You have a predisposition to possibly develop this disease. I mean, this disorder, not disease. Uh, Being female, as I said beforehand, two-thirds of the known kleptomaniacs are female, so that is still something to kind of note. Having another mental disorder like anxiety, anxiety, substance abuse problems, a personality disorder, OCD, bipolar, these are all disorders. A lot of these disorders also have to do with serotonin levels. So, and they also have very high comorbidity rates with other sort of disorders. So it is certainly seeable that you may fall into an accident. You may fall into an accidental kleptomania streak. And the last one that someone mentioned was head trauma or head injuries. And we all know the story of the man who got a pole stuck through his head and changed who he was. So injuries to the brain can actually potentially develop a disorder that you otherwise did not have a history of. Now the treatments for this disorder are, I want to be mindful and say that these are not all the treatments, but these are the general treatments. I'm going to start with the medications. You can take medications, but something about them is that they are not perfect causes. Like, there is no cure for kleptomania, unfortunately. There's only treatments that you can use to make it more livable with. So some of the medications you can take are an antidepressant that acts as an SSRI. That will help, but people have also stated that it doesn't, that there is a lot of relapse with that, as well as you can take an opioid antagonist that acts to lessen the urge to steal. Which again, they're both really good for, I'd say they're both really good, but I would also state that you could do something otherwise, at least, to say, and that both of these medications come with a myriad of side effects that people usually are not ready for, which in some cases they can help other mental disorders and actually cause other mental disorders. It's a strange topic to look into. And then the next part is cognitive behavioral therapy. This is the generally used the most, and they usually use techniques such as covert sensitization, where you picture yourself stealing the object and then fighting the urge to steal it. They have aversion therapy where you practice painful techniques in order to kind of crunch down on that whenever you have the urge to steal, so you can fight the urge to steal but through pain. And they have systematic desensitization, in which instead of practicing painful techniques, you practice relaxation techniques to sort of curb your urge to steal. So all of the cognitive behavioral techniques are all about kind of curbing that urge to steal. And the big part about this that all therapists really say that helps more than anything else is having a good, strong social support. So they recommend that you get the support of your family and friends, and really just, you have to look past the shame, because there is no shame in having a mental disorder. They really look past any of this and just get the support of them, because it will help you stay on track. And they also say stick with your treatments and stick to practicing your techniques to control the disorder. There's definitely been a show that people who have strong social supports and stick to their treatments don't relapse near as much as people who fall off, which I could understand. And one of the big things that really bring these people around to being careful with kleptomania, I think, would be the potential jail time. They really do kind of have to what's the word I'm looking for? It puts their life in perspective, and kleptomania is not a disorder to be ashamed of or anything of such. Even just looking at how rare it is, I think that some people who are in jail right now actually just suffer from this disorder and don't know it. They think that there's a problem with them, but because they don't seek help, and that they've already gone to the kind of worst conclusion that they can get to. So I think that this disorder needs more studies on it. I think this disorder can do a lot. I think there can be a lot done for this disorder if people are willing to take the time to treat it. I'm Ryan Albino. That was me talking about the impulse control disorder known as kleptomania.